Welcome. Welcome to forpay.org. This is Consumers Doctor, Dr. Bengala. Let's talk about insurance. Insurance in general, it doesn't matter, home, auto, health. The insurance premiums are based on the concept of risk pooling, folks. Premiums are based on the risk pooling. Sharing a potential risk cost with a large group of similar risks. That's a basic concept, folks. That's how the premiums are based, especially when you talk about health insurance. What does similar risks mean? It means grouping people with their health status. Now, today, the health insurance premiums are based on a broad category. They're not based on risks. That's where their premiums keeps rising because they are so broad-based. You are paying for the uninsured. You are paying for these illegals coming into this country. You're paying for all people with health problems. You're paying for the drug addiction. You're paying for all that. It is a fundamental right to be grouped with others who have similar health risks. Is it good or bad? It's good or bad. Only then you will be able to get a relevant and timely information and appropriate level of coverage and proper medical care at an affordable insurance premium. It's not happening now. It is, as we speak, our health premiums are not based on similar risks. Grouping people by their health status makes sense, folks. Yes, it makes sense. For example, I'll tell you. Number one, catastrophic, like cancer, rare diseases, head trauma, burns. They are catastrophic. They should be grouped under one category. The second category, chronic and persistent illnesses like asthma, diabetes, heart disease, and mental health. That should be grouped together. And number three, at risk, acute conditions. Yes, acute conditions support smoking, high blood pressure, overweight. That should be categorized into at risk or acute conditions. Then rest of the folks, they should be in well category. Well category people have no claims, have very low risk, good nutrition, and active lifestyle. These folks, their premiums should be affordable, and they should have a lower premiums, folks. Especially when you're buying a deductible, their premiums have to be way low because they're not seeking any care. They're still paying for the health insurance. This morning I talked about why is it people don't want to buy health insurance. Generally, people have a tendency, why waste money in buying health insurance? That's the mentality we have. So that's why I've been talking about. Today I'm talking about this risk-based insurance. So you have to be grouped according to the risk. So basically there are only 4 categories, folks. It is not a difficult thing to do. We can categorize into 4 categories. I'll tell you. Well category. We were talking about broadly. Majority of the Americans are in well category. 48% of the folks are healthy. They have no issues. They have no healthcare related issues. And among the 48%, there are only 12% of the claims. 12% of them have claims. Actually, if you really look at like 68% of them, total is 68% of them are in well category. So majority of the Americans are healthy and their claims are only 12%, folks. Whereas at risk, like acute condition, people who smoke, who have a high blood pressure, have overweight, have diabetes, they are roughly around 15%, folks, 15%. And their claims are also is around 10% claims, roughly 10%. When you look at the chronic conditions like people with asthma, diabetes, heart disease, mental health, those are the people who have chronic conditions. They're only 16% of the entire population, folks. 16% of the entire population have chronic persistent condition, 15 to 16%. And their claims are whopping 48%. They are the one who are putting maximum. So even their premium should be categorized into that group. So catastrophic or people, only 1% of the folks needs catastrophic coverage and their claims are 15%. Only 1% of the entire population have catastrophic. So they should be. So you can see majority of the 68% of the American population are in well category and their claims are only 12%, as I mentioned. 20% of the population are at risk for medical care. They generate like 25% of the claims. Whereas 15 to 16%, I'm repeating this again, 15 to 16% of them are chronically impaired. They have 48% of the claims, folks. Again, 1% of the population are under catastrophic. Their claims are 15%. So this segmentation does seem to lower the premium because once you segment it, especially when you're buying a deductible, traditional health insurance would be higher. But if you buy a deductible health insurance, the reason why I keep saying you need to buy a deductible because you qualify for a health savings accounts. So you can save money on your premium and put it into the health savings. Either low deductible, high deductible, your premiums. Generally, your premiums are based on, if it's a high deductible, your premiums are lower. If it's low deductible, your premiums are higher. So it's according to the deductible factor, your premium is based. Then you qualify to put money aside, as I was mentioning this morning, $10 a day, folks, for an individual. $10 a day. You're talking about $300 a month. It comes to around $35 for an individual. For a family, $20 to $25 a day. $20 to $25 a day. You're talking about roughly about 700, 750 in that range per month. Even people who are making minimum wage, ideally the employers, see, small employer group should be able to get a health insurance. We need to focus on smaller employer groups, folks. That's where we have been missing. It's a lot of majority of the larger employer groups are already covered. 70% of the entire population you have a larger employer group. They're already covered, folks. I'm talking about the rest of the smaller employer, 20-25% of the smaller employer groups. They are the one we need to focus on. And the smaller employer groups should have an opportunity. Instead of, maybe you can put workman's comp and everything together and combine it and cover the health insurance at the same time. It can be done, folks. Really, they should be incentivized to put money aside into health savings. That's what I would like to see happen. They should be incentivized so they can put money aside for their future healthcare needs. If you really look at the reality, folks, I'm telling you, neither the politicians nor the insurance industry are talking about the risk segmentation approach. Why? They like the status quo. They like this. They don't want to even talk about the risk segmentation. So they want to keep it as a status quo. Politicians seem to prefer centralized, one-size-fits-all approach. They seem to like that idea. That's how we got Obamacare, single risk pool, with everybody grouped together. That's how we got Obamacare. Single risk pool system is where everyone's premium is based on everyone's health risk. How do you like that? Do you want to pay for somebody else's risks? I want to ask this question to all Americans. Do you want to pay for the illegal Americans? Do you want to pay for people with chronic illness? Do you want to pay person who's smoking, it doesn't care about his? Do you want to pay for the rest of them? Obviously, Americans want to lower their premium and they want to stay healthy. This is where we don't seem to be focusing on. Your risk should be based on the groups. If we categorize into risk, otherwise there is no financial benefit to being healthy. This is where we are heading, folks. People put on weight, obese, they don't take care of their health, and they want to be dependent on the government to take care of them. This is where we are not incentivizing the folks to be healthy. This is where we should be focusing on. Health of the nation depends on each and every American to take care of themselves. This is where I've been talking about consumer-driven healthcare. And you should, everybody, even people with minimum wage should be able to. With $15 minimum wage, the individual person should be able to buy health insurance. And I was telling you, if they buy a deductible health policy, 4pay.org, it guarantees you that you will return whatever you pay into it, you will get your money back. It's worth it, folks. It is really worth it. Even people on a minimum wage, you have to, as an individual and as a family, you will get your money back in your health saving because you're putting money aside into your health savings accounts. That's the way to go, man. That's the way to go. I keep talking about this deductible health insurance and health savings that incentivizes folks to be healthy, and you're categorizing your premiums are based on the category. Like majority of them are well category, they want to stay well healthy, they want to be in the healthy group. And people with smoking at risk, people with other health conditions, they will be categorized into at risk. Well, the chronic illness folks are only 15%. You mean to say America cannot take care of the 15% of the population with chronic illnesses? They can be, if we structure it right. If we structure it right. I think it can be. And those 15%, 15 to 16% claims are almost half, folks, 48 to 50%. These are the people have the largest claims, and we can take care of these folks. And rest of the healthy group should be awarded for their healthy behavior, and their premium should be lower, and they should put money into their own pockets, into the health savings. Folks, this is the way to go. I really believe risk segmentation is the way to go. So your premiums could be more affordable, and they have to be transparent. And the folks should be able to pay the bill as they receive the care. These billing systems have to go. Billing systems, the CPT, DRG course are made up numbers, folks. They are not true. They're true numbers. They're all made up. Hospital charges, providers charges, you name it. They're all made up. It is not based on the consumer demand. Ideally, it should be based on the consumer demand like any other sector. I hope I'm giving you the right message, folks. Consumer demands determines the prices of any healthcare aspect of it. So let's keep talking about it. If you think there's a value, I've been looking into the subscription of this channel. I want to give you the right information for the healthcare. I want everyone to benefit this health insurance and health premiums and health savings. Folks, if you do like this channel, subscribe, share, and make some comments, and hit that like button, man. Hit that like button. Thank you, guys. Goodbye. God bless. See you in the next segment.